The skill is changing an occupied bed. Knock, knock. Hi, Mr. Jones. My name is Jennifer, your CNA, and I would like to change the bed while you're in. Is that okay? All right, I'm going to wash my hands, get my supplies. Washing my hands. Okay, the supplies I need are bath blanket, flat sheet, fitted sheet, and a pillowcase. I'm going to borrow your call light, please. First thing I'm going to do is put this bath blanket on you so I can take the top sheet off. Actually, the first thing I'd like to do is raise the level of the bed so it's not so hard on my back. You're not too close to the edge of the bed. That's an important patient safety issue. To make sure your patient's not too close to the edge of the bed. So you have to verbalize that. Also, before I started my patient care, I would have closed the curtain. So I'm going to close the curtain now with a barrier. Now I can change the linen. So now I'm going to put the bath blanket on. It's really important that you don't shake the linens. That's an infection control issue. Okay, hold this please at the top. I'm going to take the sheet off. You do everything undercover to keep from exposing your patient. Loosening the ends of the sheet. And you roll the sheet off of the bed, roll everything up. All your linens should always be rolled up so there's no chance of them dragging the floor. It's an infection control issue. And put it in my laundry basket. Now I'm going to change your bottom sheet. Would you prefer to turn that way first or this way first? Okay, so I need you to scooch towards me just a little bit. Okay, now roll on your side. Ready? 1, 2, 3. And be a good patient. Don't roll up into a ball, meaning don't bend your knees and don't bend your head over because that does not help your person that's doing their skill. Take everything off from head to toe first. Work everything, head to toe. And if you're the patient, be a good patient and don't wiggle. Stay in the position your CNA puts you in so you don't mess your CNA up, taking their skills. It's important that you put this bottom sheet on right side out, not inside out. And again, still work head to toe. Don't be afraid to lift up the corner of the mattress to get your flat sheet under it nice and tight. Make sure that your flat sheet, your fitted sheet on the bottom has no wrinkles. Okay, so on the count 3, you're going to roll over. You're going to have a hump. Ready? 1, 2, 3. Stay right there. You're not too close to the edge of the bed. Now scooch towards me just a tiny, tiny bit. Okay, now you're going to roll on your other side. Ready? 1, 2, 3. Nice and straight. You're not too close to the edge of the bed. Nope. And that really shouldn't be posed as a question. It's more of a statement and you have to check. It's important that you do not allow your patient to be on the bare mattress at all. So address that as you're taking your sheet off of the mattress. Put in my laundry basket. Don't move. If your fitted sheet is bigger than your mattress, just pull it out, tuck it under, make sure there's no wrinkles. Okay, roll back on your back. Now I'm going to make a correction because each time I rolled my patient, I should have adjusted the pillow to go with him so that his head stays on the pillow. I'm going to put the flat sheet on now. It's important that you keep space between you and everything you're doing so you don't get zinged for infection control. This is where the top sheet has to be inside out because you're going to make a cuff, and when you make that cuff, it's on the right direction. Have your patient hold this again. Hold that please, both hands. I'm going to take the bath blanket off. This is also where it's important when you're rolling your patient side to side that they don't turn into the human burrito with that bath blanket. So make sure that when you're turning them, they're not going to be rolled up in it. Bath blanket in the laundry. You can choose to put your sheet over the end of the bed, or you can just leave it at the end on the mattress. If you put it on the end of the bed, just be careful that your corners aren't hanging down so low that they're going to touch the floor. Always make your bed one side at a time. I like to put my back towards my patient. You tuck in the mattress. I lift up the corner of the mattress, tuck it under. Make your mitered corner on this side. Tuck your sheet under. If you tuck your sheet under properly, when you grab it, it should come out about a foot or so towards the head of the bed. You're going to grab your top sheet around where the seam of the tucked in part is. Pull that up, tuck it under, there's your mitered corner. Now I'm going to make the cuff. And I need to make the tent so that we don't cause pressure sores on my patient's toes. Just going to pull it over. Make a little fold, that's all you have to do. It doesn't have to be beautiful as long as you're doing it. Put your head up, please. Lay your head down. Taking the pillowcase off, I like to turn away from my patient. Just hold on to the pillowcase, or the pillow, and you have to roll the pillowcase off. Laundry basket. Your pillowcase. You have to roll it up in your hand to get to the end. I tell my students, as long as you can grab the end of this pillowcase and put it on the end of your pillow, just make it flat on the top and grab it firmly. You can do everything else you need to do with that pillowcase. Close it like an envelope, just tuck it. Make sure the opening to the pillowcase is away from the entrance door. So I'm going to make sure this is pointed that way. Okay, lift your head, please. Here's your call light. You're going to lower the level of the bed. You're not too close to the edge of the bed while I'm changing the level of the bed. Some of these beds lower really low. Just make sure that you're going about knee level. While you're going knee level, make sure you're watching your sheet so that it's not going to drag the floor. Would you prefer your table over you or next to you? Would you prefer a magazine or a newspaper or your TV on? Get a magazine. You physically have to get a magazine. There's your magazine. I'm washing my hands. Open my curtain with a barrier. Before I say I'm done, I'm checking to make sure I did everything I'm supposed to. I lowered the bed. I took the bath blanket out because sometimes that's forgotten. Asked him about preferences. I'm done.